Hey, welcome back to SPD Study Guide. If you're studying for the CRCST exam, this video is for you. Today, we're going to go through 20 CRCST style practice question covering some of the most important concepts every sterile processing technician should understand. We're going to cover decontamination, cleaning, sterilization, biological and chemical indicator, instrument inspection, packaging, infection prevention, storage, documentation, and more. Here's how we're gonna do it. If I'll give you the question and possible 4 answers. You'll have a few seconds to choose your answer before I reveal the correct one and explain why it is correct. Keep track of your score because at the end we're going to see how you did. Remember, these are original educational practice questions designed to help you study. They're not actual CRCST examination question. Let's get started. What is the primary purpose of point of use of surgical instrument? Option A, to sterilize instruments before transportation, to prevent soil and blood from drying on instrument, to eliminate the need for decontamination. Option D is to prepare the instrument for sterile storage. The correct answer is B, to prevent soil and blood from drying on instrument. Point of use treatment helps keep gross soil from drying onto instrument surface. Once blood and other organic material dry, instrument can become much more difficult to clean. Remember, point of use treatment is not a replacement for cleaning. What does the term bioburden refers to? Option A, a sterilization chemical. B, microorganism or organic contamination presented on an item. C, a protective packaging material. D, a type of biological indicator. The correct answer is B, microorganism and organic contamination presented on an item. Bioburden refers to microbial contaminations associated with an item. In sterile processing, blood, tissue, and other organic material can contribute to the contamination that must be removed during cleaning. This is the reason why it is such a critical step. Which statement best describes biofilm? Option A, loose dust found on storage shelf. B, protective layer of packaging. C, a structured community of organisms attached to a surface. D, a sterilizer monitoring device. Answer C, a structural community of microorganisms that attach to a surface. Biofilm develops when microorganisms attach to a surface and becomes embedded within a protective matrix. This can make microorganisms significantly more difficult to remove. That is why allowing contaminated instruments to sit and dry can create serious cleaning challenges. Question 4. Why must instrument be thoroughly cleaned before sterilization? Option A, soil can interfere with sterilization process. Option B, sterilizers cannot reach high temperature. Option C, cleaning automatically sterilizes instrument. Option D, cleaning replaces biological monitoring. Option A, a soil can interfere with the sterilization process. Remember that sterilization cannot compensate for inadequate cleaning. Residual soil can interfere with sterilization process and prevent the sterilizing agent from properly contacting the instrument surface. Here's an important phase to remember. If it's not clean, it cannot be considered ready for sterilization. Question 5. A technician is working in the decontamination area where splashing may occur. Which PPE principle is most important? A PPE is optional when instruments look clean. B, appropriate PPE must protect against anticipated exposure. C, only gloves are ever necessary. Option D, PPE is only required during sterilization. Option B, appropriate PPE must protect against anticipated exposure. Remember, decontamination presents exposed risks from contaminated instruments such as blood, body fluid, chemical, and splashes. Employees should wear PPE appropriately to the hazard and task to be performed. Why is one-way flow important in sterile processing? Option A, to make the department look organized. B, it reduces the risk of cross-contamination between dirty and clean areas. C, it eliminates the need for PPE. D, it allows contaminated instrument to bypass cleaning. The answer is D. It reduces the risk for cross-contamination between dirty and clean areas. SPD workflow should progress from contaminated activities towards clean preparation and ultimately sterile storage and distribution. We don't want contaminated instrument traveling backwards into clean areas. Question 7. During an assembly, a technician noticed visible soil on a surgical instrument. What should happen next? Option A, wipe it with a dry towel and package it. Option B, sterilize it immediately. Option C, return the instrument for cleaning. Option D, place it at the bottom of the tray. Option C is the correct answer. Return the instrument for cleaning. Any visible soil means that the cleaning process was not successful. The instrument must not continue through assembly or sterilization. It must be returned for appropriate re-cleaning according to department procedure. Question 8. Why should instrument be checked for proper function during inspection? A, to make tray heavier. B, to ensure instruments are safe and functional for use. C, to reduce sterilization temperatures. D, to replace cleaning. The correct answer is B, to ensure instruments are safe and functional. Sterile does not automatically means functional. An instrument must be clean and eventually sterile, but still be damaged or unsafe. Technicians should inspect instruments according to their design and intended function. Question 9. An instrument that enters sterile tissue or the vascular system is generally classified as A, non-critical, B, semi-critical, C, critical, D, environmental. The correct answer is C, critical. Critical devices enter sterile tissue or the vascular system and require the highest level of reprocessing appropriately for that device. Question 10. What is the one major purpose of a sterilization packaging system? A, to prevent the sterilant from entering. B, to allow the sterilant penetration while maintaining protection after processing. C, make every tray waterproof. D, replace sterilization monitoring. The correct answer is B, allow sterilant penetration while maintaining protection after the process. An appropriate packaging system must allow for sterilizing agent to reach the content while also help maintaining the integrity of the process item during handling and storage. What is the main purpose of a chemical indicator? A, to prove an item is sterile. B, to show exposure to one or more sterilization process condition. C, to clean surgical instrument. D, to identify microorganism. The correct answer is B, show exposure to one or more sterilization process condition. Chemical indicator respond to certain process variables or condition. But here's an important part. A chemical indicator changing appropriately does not by itself prove sterility. Question 12. What does biological indicator evaluates? Option A, the color of surgical instrument. B, the lethality of the sterilization process using the highly resistant microorganism. C, whether a tray is heavy. D, whether packaging looks attractive. The correct answer is B, the lethality of a sterilization process using highly resistant microorganism. Biological indicators use highly resistant microorganism or spores to directly challenge the sterilization process. This makes biological monitoring an extremely important part of the sterilization quality assurance. What is the purpose of the Boyd test? A, test instrument sharpness. B, detect inadequate air removal and steam penetration in applicable dynamic air removal steam sterilizer. C, determine whether instruments are clean. D, measure the storage temperature. Correct answer is B, detect inadequate air removal and steam penetration. Applicable dynamic air removal steam sterilizer. The Bowie-Dick test evaluates air removal and steam penetration performance in applicable pre-vacuum or dynamic air removal steam system. It is not a sterility test. Remember that. Question 14. Which is an example of a mechanical monitoring of a steam sterilization cycle? Option A, record time, temperature, and pressure. Option B, instrument count sheet. Option C, storage shelf label. Option D, an hygiene record. The correct answer is record time, temperature, and pressure. Mechanical monitoring involves review the sterilizer's physical cycle parameters such as time, temperature, pressure, depending on the sterilizer and cycle. A wrap package is wet when removed after a complete steam sterilization cycle. What should the technician do? A, put it directly into the sterile storage. B, gives it an operating room immediately. D, dry it with a towel. D, consider the package compromise and follow facility procedure and processing. The correct answer is D, consider the package compromise and follow facility procedure for reprocessing. Moisture can compromise package integrity and creates contamination concern. A wet pack should not simply be dried off or treated as sterile. A sterile package falls and the technician discovers a tear in the wrapper. What should happen? A, use it because it was previously sterilized. B, wrapped over the tear. C, consider the package compromise and reprocess the item. D, put another wrapper on it. The correct answer is C, consider the package compromise and reprocess the item. Sterility depends on maintaining package integrity. If the package is torn, punctured, wet, opened, or otherwise compromised, the content cannot simply be assumed to remain sterile. What does related sterility mean? A, every package automatically expires after 7 days. B, sterility is affected by events that compromise package integrity. Sterile package never needs inspection. Option D, every package expires after 30 days. The correct answer is B, sterility is affected by events that compromise a package integrity. Events related to sterility focus on whether something has happened that compromises the package. Example can include moisture, tear, puncture, improper handling, and other damages. Which practice is most appropriate when handling sterile packaging? A. Handling package unnecessary throughout the day. B. Storing them where they can easily become wet. C. Minimizing unnecessary handling and protecting package integrity. D. Place the damaged package behind intact one. The correct answer is C. Minimizing unnecessary handling and protecting package integrity. Sterile packaging should be handled carefully and stored in a way that protects them from contamination and damage. The more unnecessary handling package received, the more opportunities there are for the integrity to become compromised. Why is sterilization documentation so important? A. Because management wants paperwork. B. It replaces biological indicators. C. It eliminates the need for monitoring. D. It supports quality assurance, traceability, and recall investigation. The correct answer is D. It supports quality assurance, traceability, and recall investigation. Documentation provides traceability. It's there if there is a sterilization failure or recall. Records can help identify the affected load and items and support the facility investigation with the response. Our final question of the day is that a technician removed a process tray and noticed that the external chemical indicator has changed unexpected. What is the best action? A. Sends the tray to surgery anyways. B. Change the indicator manual. C. Consider the item inappropriate process until the situation is evaluated according to facility procedure. D. Ignore the indicator because the sterilization cycle has complete. The correct answer is C. Consider the item improperly processed until the situation is evaluated according to facility procedure. An indicator does not demonstrate an expected response is a warning sign. Technicians should not simply assume the package is safe to use. The item should be withheld from use and the situation evaluated according to facility policies and applicable sterilization, instruction, and monitoring requirement. All right, how did you all do? Count the correct answer. If you score 18 to 20, excellent work. You understand these concept is looking strong. If you score 15 to 17, you're doing well, but review the question you have missed. If you score 10 to 14, you have built your knowledge, but there are several areas that you should review before exam day. And if you score below 10, don't get discouraged. Go back through the video, take note, focus on understanding why each answer is correct. Remember, passing the Crcst exam isn't just about memorizing answer. You need to understand the principle behind sterile processing. If you are preparing for Crcst exam, make sure to subscribe to SPD Study Guide because you're going to continue breaking down sterile processing concept in a way that is simple, practical, and easy to remember. Coming up, we'll uncover topics like bioburden versus biofilm, sterilization monitoring, decontamination, surgical instrument, one-way flow, infection prevention, and more Crcst style practice question. Here's your challenge. Comment below on your score out of 20 and tell me which question gives you most trouble. If this video helped you, like the video, subscribe to the channel, and share it with another future sterile processing technician. Remember, don't just memorize the answer, understand why behind the answer. I'll see you in our next SPD study guide video. Keep studying, keep learning, and I'll see you next time.